If you're watching this on Moodle or you're floating by on YouTube, a very warm welcome. My name is Rory Oakes and today I'm in Chorlton with Bob Cook from the Manchester Institute for Psychotherapy.
Hello.
And today we're talking about supervision. And it's an important part, it's an essential part of any therapist's life to see their supervisor or joining in a supervisory activity or alliance for the benefit of clients. So let's just start, Bob, with a definition of supervision.
Oh, that's a good place to start.
I think so.
Now, let's look at a modern definition, but before I do this, let's go back.
Okay.
Because supervision is a pretty modern profession.
Right.
So you look at the definitions of supervisions, say only in 1950, 1960, 1970, 1980, which is really when supervision started to take its own life. Most of the definitions were really educative, seeing supervision as an education process, right, often as teacher-student. So it was very much one up, one down in a way. So there was no really, well, there was, but not so much mutual collaboration.
Right.
It was the teacher telling the student what to do.
Sure.
So modern day definitions are much more around a co-creation, a relationship, an adult relationship, in transaction analysis terms,
sure,
rather than perhaps what often was seen as a parent-child relationship,
sure,
in supervision. So for me, supervision is an adult to an adult learning process.
okay.
It is where the supervisor is facilitating the therapist stroke supervisor to do their best job with their client.
Sure.
So there's three of them. There's the supervisor, there's the supervisee, and there's the client.
Yes.
And the supervisor's job is to help the supervisee give their best services to the client.
Yes. And for those of you watching who may not be in the world of counselling or psychotherapy, no matter which organisation or body that you're part of, there is a ethical imperative to offer the very best service to clients, and not only that, to make sure that you're in a way being looked after. And I think sometimes that's lost. Certainly with the people that I teach, I always say that in the BACP Code of Ethics, self-care is an ethical imperative. It says it quite clearly.
Absolutely, that means having access to your own therapy.
Yes, absolutely.
And I think some supervisors forget that. They've been, therapists, they get qualified as therapists, they may do 2, 3, 4, 5, 6, 7 years as therapists, and they may then sometimes not have the therapy or access to the therapy I think they should have.
Sure.
And I think any supervisor, certainly I do in the contract I get my supervisees to sign, is that they have access to their own therapy and this self-care that you're talking about. I think it's a really important part.
Yes. And I guess that there's different models of supervision, and if you buy the books or you do an online search on the internet, you'll see lots of definitions of it. But what model is preferable to you? What's the model that you're most familiar with?
I'm glad you asked about it, because there is a lot written on supervision.
Yes.
I think it's a career that is getting bigger, an area that is becoming more popular, thank goodness. But a book I really would like to recommend is written by Robin Schoet, that's S-H-O-E-T, and Peter Hawkins, and it's called Supervision in the Helping Professions. First one in 1989, and there's been many editions since. And I recommend you buy the edition after 2002 because the updates they've made are very significant.
Sure.
Now there's two basic models in there that I like. One is a model called the seven-eyed model,
sure,
which is a a model which shows where you are at every time in the supervisory process, which is very useful as a supervisor to be able to think, understand and look at the interventions that you will make according to which mode you're in.
Yes. So it's a structured approach.
Correct. It's also used, and I like this very much, as a parallel process model. In other words, how does the supervision that you do with your supervisee reflect what the supervisee stroke therapist does with their client? How do those two overlapping relationships get played out in the supervisory role and the therapeutic role?
Yes.
And I like that connection with that model.
Yes.
The other model which I very much enjoy thinking about is a professional developmental model. The one I like is by Stoltenberg and Delworth, who were two therapists and researchers in supervision who looked at how therapists go through a professional developmental path when taking up the new profession of being a well-seasoned therapist. In other words, for beginning therapists, the supervisors need to think of certain types of interventions because the new therapist needs certain things which are different than the experienced therapist from the supervisor. So for example, the younger therapist, that means the first therapist has been qualified for 2 or 3 years, will want from their supervisor more of a toolbox.
Yes.
This is how you do it. And the focus will be more from the supervisor, am I doing this right or am I doing this wrong?
Yes.
Whereas a seasoned therapist wants more of a supervision which is more often psychodynamic, more using the parallel process,
Yes.
and in fact, in some ways, more collegial.
Yes. Yes.
And so you have a professional developmental arc, and if you put those two models together, the one I've just talked about in terms of the Sherwood Hawkins seven-eyed model, which is more looking at the process of the two relationships I've talked about, or knowing where you are in terms of a grid of supervision, and the professional developmental model, you've got a pretty two neat models to look at when you're thinking of supervision.
Sure. And I think it's interesting that you bring up, and certainly for those of you who are watching who are just coming into practice, you maybe have started your training years September this year, or you may be thinking of starting in September of the next year. I think that there's always talk about this feelings of incompetence. This right at the beginning of practice, it comes up. It's come up with me in my training years, and I think very few trainees escape it. This idea of, am I doing it right? Am I saying the right things? Are the cushions positioned in the right place? All that type of thing. And so what I'm hearing here, Bob, is the this idea of this journey of practice, this journey the therapist takes. Right at the beginning, it may be around educational work. It might be about stroking work in terms of TA or being supportive, using the core conditions in a more person-centred. But at a point, there's a wonderful phrase, journey person, isn't it? It's apprentice, journey person, and master craft.
And that's also in that Hawkins book.
Yes.
And on top of that, I think it's important, well, I talked about supervision, to talk about the tasks of supervision.
Yes.
Also in that book, they talk about the tasks of supervision. And if we looked at some of them, we need to talk about the task of education and supervision. So when you're a supervisor, you will also be teaching the new therapists certain aspects of how to do therapy. Or you'll be looking at, say, for example, how you would work with personality disorders. So, the actual new therapist often needs to be taught areas they've actually got to reflect on, re-evaluate, or don't even know. So it's an information piece. So a supervisor has an education task Other tasks will include a business and monitoring task, where you would ask such questions as, you know, how often do we meet,
Yes.
how much is the supervision, what's the administrative contract of the supervision,
Yes.
and the supervisor is responsible for that.
Yes.
There's also the task of what I call gatekeeping,
Mm.
which is responsible for the ethicality
Mm-hmm.
of supervision. Many therapists, believe it or not, might not know when they're being unethical.
Yes.
So, as you said at the beginning, it's a major job for the supervisor to monitor the ethicality process within supervision.
Absolutely.
So we start having tasks of supervision.
Yes.
It's important that any new supervisor thinks about.
Sure. And I think you make a good point, because in my experience, which is a lot less than yours, Bob, but in my experience, it is those things that are outside awareness
Yes.
that
Yeah.
cause practitioners to get into difficulties and sometimes push bad decisions.
Absolutely. And one area we haven't touched, which often is a really big area, where the new therapist often needs quite a lot of supervision in, and the new supervisor does as well, is what is the difference between therapy and supervision?
Yes.
So
Yes.
many of the new supervisors, they might start doing therapy in supervision.
Yes.
Now, perhaps some supervisors might think that's a good thing, but you know, I think it's a difficult one, because then if you start doing therapy in supervision, there is straight away a contractual incongruence
Yes.
and a object relations confusion.
Sure.
So I think it's a very big area, and I personally keep those two roles separate.
Sure. And for those viewers who may be working in a more person-centred role, you use the declining word object relations.
Oh, yeah. Okay.
I wonder if you could just kind of expand on that, what that might look like, or
How might that look at? You go for supervision, and the supervisor, who is in the role of being an adult-to-adult supervisor, talking about professional direction,
Sure.
helping you have new skills,
Yes.
and that's how you see the person. And then suddenly they start acting like your therapist, or
Yes.
doing therapy. That can cause a confusion
Yes.
in your psychological persona. Suddenly I'm having to look at perhaps my supervisor being my dad, or my supervisor
Right.
being like my uncle, but I want him to give me advice on how to be a therapist, not to reparent me.
Yes.
That's what I mean by confusion.
Yes. So that sense where this duality,
Yeah, the duality.
and confusion that's generated by the task of supervision being diluted, or maybe unclear, maybe
Unclear.
very vague, muddy.
Yeah. Muddy, yeah. I mean, fair enough for a supervisor to do some grounding techniques. If you just come in for a piece of supervision, you've been in an accident,
Mm-hmm.
or you've seen somebody else being traumatised, or some process where you might have regressed momentarily,
Yes.
then that's fine for the supervision, I think, to do grounding work, get
Sure.
you back in adults so you can actually do some supervision.
Yes.
But not to go back and say, oh right, let's go back to when you were 3, when you had some sort of process going on there,
Yes.
which may infantilise the supervisory, and how can they then do how can they do supervision? They're caught in some regressive world, so you've got confusion.
Yes.
The supervisor often doesn't know where they are.
Yes. Yeah. So that's a really clear explanation. This notion that a supervisor may be in their own process, lost in their own process, and not present with the supervisor to bring the client caseload and work with client's process.
Yeah, caught in a transferential mire. They're caught in a transferential mire.
Yes.
They don't know who they are.
Yes.
And they don't know who the supervisor are.
Yes.
And what relationship have I got?
Yes.
How can learning take place
Yes.
from that
Yes.
position?
It's complete stuckness. Complete.
I think so.
Yes.
That's where I come from.
One of the things that my learners often ask is how to pick a supervisor. And
Good question.
means and thorn in the book Person-Centred person-centered therapy today, they talk about if you meet a supervisor and you have a strong reaction, don't dismiss that, just go ahead, process it and think about why you're having that strong reaction. And that's the kind of reflection I give to my learners. So how should someone, or what are the indicators of building this professional alliance? What does it look like?
Yeah, I'm not quite sure what you put on your blog. I know on your YouTube channel you've written about this, or on your blog you've written about this.
Yeah.
And I don't remember what you said, but I know what I think.
Right.
If you go, well, number one, go and interview. Go and interview your supervisor to be.
Yes, absolutely.
Go and, because you're going to be in a relationship for 2 or 3 years with this person,
absolutely.
Once a month. So you need to know that he's got the qualities, the attributes to help you get what you want. So go and interview him and say, what can you do with me? What's your contract? What's the expectations? What do you expect of me and what should I expect of you? And get the formulation of an adult to adult contract. That's number one. So that you have time from an adult to look at, do I want this person to be my supervisor? Secondly, do not pick a supervisor that reminds you of your brother, friends or father or mother. Pick somebody that you can be with in the here and now. Don't go into some transferential mire with them.
And I know that's happened on the course of the siren where someone's come in and said, oh, it looks like my father, this guy's right. And I said, no, you're going to get caught up with that. I mean, it's just happening in training, you have to say, and that's something that needs to be worked out. But yes, so it's this idea that you're too busy thinking about subconsciously getting involved with this person who looks like someone in the long distance past maybe, and getting confused. So the first thing is make sure you get on with them. Make sure that you know exactly what you're getting. And the other...
Yes, I've got another one for you. I told you about the transferential mile. I want you to make sure that they know what they're doing. In other words, that they can offer you the things that you need. I know you'll be doing that in the interviewing process, but you want to make sure that they're well read, and most importantly, they can stretch you professionally. Because you don't want to go to somebody who's going to not be able to do that. Now, what does that mean? That means somebody who probably is a little bit higher up the rung than you, that is able to talk meta-perspectively across different modalities. Somebody who's actually been on a supervision course like mine. Somebody.
Is that a plum bob?
Somebody who's been around a bit. And this is important. It isn't. You don't want somebody who's just been practicing 2 or 3 years more than you.
And I guess for me, one of the things that sometimes comes up with in the tutorial with the learners that I work with is that I teach a person-centered modality, a meta model, the Rogers model, and sometimes it takes a little bit of getting an explanation to talk about that some supervision tasks are indeed psychodynamic.
That's true.
And I've had this debate on the forum recently, and the person said, I'm a person-centered supervisor, and my response to that was, I'm sure that you are, but what happens when you ask the question, when you're asking the question, who does this client remind you of? When you're asking the supervisee, who does this client remind you of? You're into the realms of psychodynamic subconscious process.
Precisely.
And I think for me, it's a really important. It is those things that are out of awareness that can cause us, or cause practitioners, the biggest difficulty.
Yeah, absolutely. And another thing I'd ask any prospective supervisor in an interview is, do you have your own therapy?
Yes.
Do you have your own supervisor? What is your agency for self-care?
Yes.
So
a good question.
You get some sense that they walk the talk.
Yes. Yes, they're living the values.
Yeah, rather than just lip service.
Modalities. One of my big things is that people who supervise should have a good understanding of the modality.
I agree with you. Absolutely. So you mean, like, for example, if you're a client-centred counsellor, then the supervisor needs to be an expert in client-centred counselling.
Yes, I'm not sure about the word expert, but needs a working knowledge of the meta model.
Oh, without a doubt. That's what I said at the beginning. They need to have been. Sorry, you need to get a supervisor who's been around a bit.
Yeah.
But specifically in the model that you're going to.
Absolutely.
So I teach people to transactional analysts. Well, it's very important that they have a supervisor that can use that model. Now, as they start becoming more advanced, they may decide to have another supervisor who specialises in there that they're interested in. But I think at the beginning, they need somebody who actually can and does know the model.
Sure.
Then they can specialise later.
Sure. And finally, because we're just coming to the end, one of the things that comes up, and I'm sure my learners are going to love me for this, is that it costs money, doesn't it? You can't get away from the fact that you pay for supervision. Now, people are, like myself, are fortunate that my supervision paid for as part of my work, but generally speaking, people pay for their supervision.
Yes.
And one telling comment from one person in the tutorial, and I know who they are if they're watching, was she's coming to the end of the 2 years with me through the practice-based course, and she said to me, "You said, Rory, good supervision is worth its weight in gold.
Yes.
And you know, if you're paying a premium for that, then you're going to get what you pay for."
Correct.
And she said, "Rory," she said, "I hated paying for supervision.
Wow.
I hated your words,
wow.
But now I realise that you were right, and that you cannot get, you cannot skimp on supervision."
No, and you know even more, besides it being wonderful outside observation, wonderful self-care for the therapist, it's wonderful modelling for the client.
Absolutely.
That you can model back to the client that you are taking care of yourself like you should take care of yourself.
Absolutely.
So modelling as well, besides all these other professional reasons.
Absolutely. Well, I hope that the people watching, the viewers watching, it may be not in the world of therapy, and you just kind of landed on this YouTube clip, and
well, you're very lucky.
So if you are, yes, as Bob said, you're very lucky. And if you're watching on either the Counselling Resource channel or Bob's TA Therapy channel, I just hope it's been really useful for you. And as always, thank you for watching.
Yeah, thank you for watching. You might have come from my website, TA Therapy, as well. No, it's been a good subject area, and please remember, the supervision is of utmost importance in the self-care of the individual, and you need to then pass it on to your clients. So thank you for watching, and hopefully you'll be back soon.
You never know. Thank you for watching.